Hello, our viewers. Thank you for watching Coherinet TV. You must have heard about AUNT KAKI in the previous shows that came on your screen. Probably you were asking yourselves questions of, what is AUNT KAKI? What does it do? Well, we are yet to find out, and also to know if it does any of closing the gaps in the communities, in the societies. This is Building Bridges. I am your host, Alex Ainembabazi. Today in the studio, we have someone who knows well about AUNT KAKI, and she'll be introducing herself to us, and then we get to know what is this AUNT KAKI. Welcome to the show.
Thank you very much, Alex.
Kindly introduce yourself to our viewers.
I'm by names of Nakalembe Fatuma, but I prefer being called Sweet Fatty.
Oh, Sweet Fatty, you're welcome to the show. We have been hearing about AUNT KAKI. It has been sponsoring a number of shows. Kindly tell us, what is this AUNT KAKI all about?
Oh, thank you, Alex. AUNT KAKI is a toll-free helpline number that offer free, stigma-free sexual reproductive health services and information. Basically, it's more into sexual reproductive health.
Now, when you talk about sexual and reproductive health, I think some of us understand it differently. Could you please break it down for us to understand the services that you actually offer?
Yeah, AUNT KAKI offers different services. And one of the services it offers psychosocial support, where someone can easily call in and they be counseled on the situation they are going through. Then it also offers referral in case someone calls in and says, okay, hello, AUNT KAKI, I want a family planning option. So it offers that referral for family planning. It also offers referrals for post-abortion care, where you call in, you have a problem, you've had a miscarriage, and you want to these referrals, so it sends you to the facilities where you can get these services. It also offers sexually transmitted disease referrals in case you have any STIs, UTIs, and you want treatments. It as well as counsels you and refers you to a facility.
Now, you mentioned something about psychosocial support, if I heard you well. Yes. I think most people out there may be having challenges when it comes to their sex life.
Sure.
Talk about sexual frustrations or what. Is it something you also offer on AUNT KAKI?
Yes, you can call AUNT KAKI in case you need that information. We live in different worlds and environments. You might find someone, okay, me, I'm like this, I'm this sex oriented, I'm of this kind of sex orientation. So you can call AUNT KAKI to seek for that information. And AUNT KAKI is always ready to give you information to make your sex life better, to make your health life better. Yes.
Talking about, I don't know if it also falls under your docket, but you'll be telling us. Talking about the sex life and what have you, do you also consider people who are like of 12 years old? Because when you talk about the sex life, I be looking at people of 20 years and above or something. Do you also consider the young people?
Okay, to first make the thing clear, when I'm talking about sex life, it's not all about the other sex life people already think about. Okay. Yes, we also look at the sexual health life, where you have safe sex, where you have appropriate sex in the right place with the right person. So to go back to the question you've asked about the 16-year-old, the 12-year-old, as AUNT KAKI, we consider packaging of our information, because this 12-year girl or young boy may request to know about something. So we offer information, but the information is tailored according to their age group.
Yes. Now, when we are talking about these young people, and I'm very sure the young people would also tell you the same, by the time a young person reaches out to you, they expect that you're going to keep this information safe. They want to feel like, now what I've told you, I'm very sure. How do you ensure that these people's information, especially the young people, their information they have shared with you is kept safe and their parents are not going to know?
On AUNT KAKI toll-free helpline, in most cases we have a policy that guides AUNT KAKI, and where people's information is kept confidential. No one accesses that information. it is only the helpline operators that have that information. Yes, so that person should be 100% sure that their information is safe. Yes.
Now, when you're talking about, yes, people are going to call in and they are looking for information and what have you, how easy is it for these people to actually get this information when they reach out to AUNT KAKI? Sorry.
When you call AUNT KAKI, we have different stages. We have different approaches. We have our AUNT KAKI family. This is a family that comprises of so many things. We have a chat box where someone can easily send a message and reply you very fast. We have a WhatsApp. You can use us as well as send a message and be replied. We have visual counseling. We have these trust issues. Someone may feel comfortable calling a counselor and they want to talk to a counselor while they're seeing the counselor. So we have that visual counseling where you can easily call us and you'll be counseled face-to-face with a counselor. We also have different social media platforms. We have the TikTok for the young people. We have the Instagram. All those are our platforms in our family that someone can reach out to us through them. Yes.
You've talked about, yes, they can reach out to you and get the information or the services. Yes. I wanted to you to help us hint on that services especially. I've called you, I'm in Barara. I come from Barara. So I've called you, I'm in Barara. I need a service. But where you are located, I can't reach out to you at that particular time. So how do you help me, someone who is in Barara, to actually get the service that I want, apart from the information?
Okay. Thank you very much, Alex. AUNT KAKI is diverse. First of all, we have over 9 languages. And you're from Mbarara, and I think Lunyankole is one of your languages that side. Yes. First of all, we give you information in your language so that you understand whatever you're asking, so that you have a healthy behavior. After giving you information in the preferred language of your choice, we refer you to a nearby facility wherever you are. We have partnered with different facilities, different pharmacies, different hospitals. So in all districts, we have these health facilities where we can refer our client for services.
Yes. Because the next thing I was actually going to ask you was, when people reach out to the health centers or the facility that we are referred to, I may be an introvert, and when I reach at the facility, I will just sit down and wait for someone to look for me. Sometimes these health providers, I think they also be busy, I don't know, so they don't have your time. No. Yes. So how does AUNT KAKI try to help out, especially because I think I've seen this with the young people. Young people reach a facility and we just sit, we wait for someone to first ask me, what is your problem? You get, yes, what can we do for you? So as AUNT KAKI, how do you help these young people in that when they reach the facility, they can also get the service they have gone for immediately?
Okay, to add on what I've said, before we refer you to a facility, AUNT KAKI first asks you, are you comfortable? We refer you to a facility near where you are. Why we do that is because sometimes we have these young people. They feel they don't want to be seen in their communities where they stay. So they would prefer to go to a different, either district, different village, where there is that facility where they can access those services. So in most cases, we first seek consent from you by asking you, should we refer you to this facility? It is in the same area where you are. So when this client says yes, we refer. If the client says no, I prefer the other one, we send the client to the other facility. Coming back to the question you've asked me, if I go to a facility, sometimes you may feel shy confronting the service providers. The beauty about you going through AUNT KAKI is, on calling AUNT KAKI for a service, once you agree and make an informed decision about what you want, AUNT KAKI contacts where you're going to. The provider would be waiting for you. As soon as you reach the facility, you present your code that you would have gotten from AUNT KAKI, and you will be helped. without getting any constraints, any difficulties, any shies, any fear for stigma because of the environment or the providers, because the provider is already awaiting to offer services to you.
That is actually very beautiful. So I can also reach out to the facility. Yes. And the Auntie Kaki, because I'm also sometimes you be shy. Depending on the situation. Anyway, we are going to take a very short break. When we return, we shall be finding out, is this Auntie Kaki located in every part of the district or every part of the country? We need to find out from them. We need to find out. Yes, she had talked about a language. Mayurunyankole, I come from the other side. She told me it is one of the languages, but we need to know how many other languages are there to help out in the other people. Let's go for a short break. Stay tuned to Coherent TV. Welcome back from that short break. Before we went for the break, our guest, Sweet Fatty, had told us about Auntie Kaki, the services it offers. And as we were going for a break, she had mentioned something about the referrals in the facilities, how Auntie Kaki helps out to refer people to the facilities. That is after they have had an engagement with the people, they call and then refer them to the facility. But now, Sweet Fatty, I would like you to help us understand this. People are going to call you on Auntie Kaki and then you do the referrals. How about students in schools where they don't have access to phones, they can't chat, they can't do anything? How do you ensure that these people also get the information through Auntie Kaki?
Thank you, Alex. For the young people in school, we have a package. As I said earlier, we have a chat box. In this chat box, it comprises of so many things. One, when we reach out to these schools, we come and give them information. We talk to them about these issues, SRH issues. Then we give them an opportunity to chat back to us through our chat box. They write back to us, telling us their problems, telling us their stories. As Auntie Kaki, we come back as a team. We sit and reply to these messages for young people, then take them back to these schools where these young people can easily get this information, as well as we can help them through this chat box. And through this chat box, most of them are even rewarded. Someone who has written so many letters back to Auntie Kaki, someone who has won, which letter won amongst all the letters that have been written to Auntie Kaki, something like that. Yes.
Now, as I'm writing a letter, assuming I'm a student, is it okay for me to write in Lugbara? Let's say I'm coming from Marua. Is it okay?
Yes, as I said, Auntie Kaki has over 9 languages. So even if you write in which language, your email, your letter is replied by Auntie Kaki in that very language.
Now, when you talk about the 9 languages, this brings a lot of questions, especially I think to also our viewers, they would also want to know how far does Auntie Kaki go? Is it countrywide? Is it worldwide? How far does it go?
One, Auntie Kaki is global. It is global. It works throughout the world. Everyone, anywhere, wherever you are, you can reach out to Auntie Kaki through different means. I said Auntie Kaki is a family which comprises of so many things. We have the different socials, we have the chat box, we have the visual counseling, we have the helpline itself, we have the SMS. So you can easily reach out to Auntie Kaki. That's why it's global.
Now, it being global and reaching out to very many people, you see, some of the communities that we live in we are not so well off financially. Yeah, we are not so well off financially. How much do you normally charge for these calls so that at least the people be knowing that I need to be with this amount of money to get the service from Auntie Kaki?
Wow, Auntie Kaki deals with people from the grassroots communities, deals with different classes. We have the high social class, the high level class impact people, we have the grassroots community people, we have the middle class. So Auntie Kaki deals with all the 3 entities of people, but it still stays with a free call approach. When you call Auntie Kaki, all calls that come in for Auntie Kaki are free of charge. You're not charged for any single shilling when you call Auntie Kaki. It's free. Like you call Airtel and MTN, the calls are free. The same applies to Auntie Kaki. It is free of charge. You're not charged for anything.
Now, another person might ask a question. Auntie Kaki is free of charge. I can get a service that I want freely. How about when it comes to the facilities or where I'm supposed to be getting these services? Is it also for free, or what am I supposed to do?
When you go through Auntie Kaki, we have two types of facilities. We have the private facilities and we have the public facilities. When you call the public facility, when we refer you to a public facility, most cases services are for free. Are for free. But when we refer you to a private clinic, remember the other one is a business. Someone is looking at paying rent, buying the medicines and all that. So they charge you but minimally, because the facility has a partnership with Auntie Kaki. So they don't overcharge you. If the service was at 10K, they can reduce for you the service and they give you the service at 5K because of the partnership between Auntie Kaki and the facility.
We all want to get services in one or another. I may be sleeping, I may have gotten a UTI from God knows where, but I think we all need the services. Now the question is, assuming I have a challenge at 3 a.m. in the morning. You see, the challenge actually is one. Most of the times at around during day, just like we are here together, you don't know if I have any issue, right?
True.
Yes, but then I normally find maybe that time where I can call a person like in the night. But also in the night, there are those times where we cannot talk because I know there are people in the house. What if they hear my problems? At what time does Auntie Kaki stop working so that we know when we are supposed to call or send a text or yes?
Okay. Auntie Kaki works 24 hours. At any time you feel convenient with yourself, you can call Auntie Kaki. And it works 7 days a week and 31 days a month. Okay. Yes, so Auntie Kaki works every day and it works for 24 hours per day. So anytime you feel comfortable calling it, you can call it. Anytime you feel comfortable texting it, you can text and get a reply as soon as possible. Yes.
So thank you so much, sweet Fatty. But we've been talking about Auntie Kaki. People can call, people can text, people can, but we have not heard about the Auntie Kaki numbers. Where can someone call from to reach out to Auntie Kaki, or can we have those numbers where we can get to Auntie Kaki?
Okay, thank you, Alex. Auntie Kaki has a variety of numbers, and we have two numbers basically for the call. We have the one which goes 0800 247 247. Okay. Then we have the downer one which is 0800 347 347. The downer one, the 347, is the Airtel line. But even if you call using AfriCell, using MTN, you can easily reach out to Auntie Kaki at a free cost. As well as even if you call the first one, which is MTN, using Airtel, you can get free services. But the magic with Auntie Kaki, let me give you a secret and a recipe today. On calling Auntie Kaki, we are going to try calling Auntie Kaki using my phone. Okay. On calling Auntie Kaki, you're going to dial the number 0800 347 347. On dialing the number, you press yes, then it will ring. When it rings like this, the magic or the recipe behind, once it starts saying so, you press an 8. Okay. On pressing an 8, you're directly going to go through without going through the queue and all that, and you talk to the doctor directly. And here we are ringing. You're going to speak to the doctor shortly. Yes. So this is the process. Wow, the doctor has picked us. Yes, this is how you go about Auntie Kaki. Thank you, doctor. So that's how you can go about Auntie Kaki to reach out to get services. It is as simple as dialing the number. After dialing the number, you press an 8. When you press an 8, your call just goes directly to a doctor. But we have another segment, which is the IVR segment, where when you call Auntie Kaki, we can as well as demonstrate it. When you call Auntie Kaki and you want to just listen to information, and you don't feel like maybe calling, talking to the doctor, or maybe talking to someone, but you feel like the recorded information is enough for you, you can easily dial again, like we dialed before. But this time, you don't press an 8. You just leave it to run. Then you'll be pressing whatever you want to listen to. If you want to listen to UTIs, you press the code to UTIs. As I said earlier, you're hearing. Which language do you want to talk the agent to talk to you in? Then you put the language. So this is a segment of the language. So after the language, we go to the services. We have the UTIs, we have the post-abortion care, we have the family planning. So it comes back to you. What you press, what you order for, is what you get. Me amwe Muganda, I would prefer to speak Luganda. Sebo jebale konze UTI ensiwa. Ensiwa bweti nina katulututu. So I would prefer to speak that language. So it comes back to what you want. Do you want to talk to the doctor? Do you want to just listen to the recorded information, which is called the IVR? You just select whatever you want.
Thank you so much, Sweet Fatty, and to our viewers, that is what Auntie Kaki is, and that is what Auntie Kaki does. I hope now all our questions are answered. If you have any questions, you can still leave it in the comment section, and we shall be looking for our experts of Auntie Kaki to give us.
Alex, what I've forgotten, as I've been talking about WhatsApp, we have a WhatsApp number which you can text us at any time you feel convenient with. We reply you. It is 0741 90 17 82. You can text us at any time. You could get information, you could get reply to, and your problems can be solved through just a WhatsApp chat with our doctors, with our professions. Yes, but Auntie Kaki only works on sexual reproductive health issues, things around these two parts. The rest, we don't handle land issues. We don't handle what other issues, but we only handle things to do with this part. Yes.
So please, as you're calling Auntie Kaki, make sure it is not a land issue. It has to be sexual and reproductive health. Yes, sexual and reproductive health. Well, thank you so much, Sweetie Fatty, for accepting and also teaching us what Auntie Kaki does and how Auntie Kaki operates. To our viewers, clearly it shows how Auntie Kaki is trying to bridge gaps when it comes to our communities, how they are trying to bring the people who are calling for a service and the providers to make sure that the person gets the service they are looking out for, they get the help that they need. We shall be getting to know more about Auntie Kaki. That is from the questions that you ask, depending on if your question was not answered or tackled. Kindly note it down in the comment section and you'll be getting the answers to those questions. Otherwise, thank you so much for being part of this show. Until next time, bye.